Hello everyone. Today we'll discuss one of the important topic of the oral cancer, that is how do we identify the oral cancer, right? So here there are two possibilities or there are two important things to remember. We need to know about what is staging and what is grading. The first and foremost, what is staging? So the staging is something where the patient comes to you, and if you ask the patient to open the mouth, that is, it could be clinically visible, right? And if at all clinically it is invisible, still there is a chance of cancer, then you have to identify it by radiographic examination, right? So does mean that clinical and radiographic examination or clinical and radiographic identification is what we use the word as staging, right? So the radiographic identification can be associated with either OPG, CBCT, CT scan, MRI, or could be your PET scan, right? Whereas clinically, it is definitely, if at all there is something like ulceroproliferative lesion, or could be any change from the normal counterpart, what we use the word as there is change. That is what we use the word as malignancy, right? Now, what do you mean by grading? Now, when you confirm clinically and radiographically, but still it is under dilemma, that is a provisional diagnosis, what we use the word as, right? Now if you confirm the provisional diagnosis, comes to the final diagnosis with the help of histopathological identification is what we use the word as your grading, right? So the staging can be classified into two forms. One is TNM staging and one is AJCC, that is American Joint Commission Committee, right? So then grading can be again classified into well differentiated, moderately differentiated, and we have poorly differentiated squamous cell carcinoma or any type of your cancers. Now here the word differentiation does mean that the cells which resembles the parental cells, right? What do you mean by the cells resembles the parental cells? Now if at all, if we have a tissue which consisting of the cells, and those are all your normal cells, right? From the beginning is what we use the word as looking like a parental cells which are normal. Now of which there are few cells which become abnormal, right? That is, abnormal does mean that which consisting of either mitotic divisions or abnormality of hyperchromatism or pleomorphism, whatever it may be, there is change from your normalcy, right? What we use the word as abnormality, and that abnormality what we use the word as your anaplasia, right? So differentiation, the cells which resembles the parental cells, and anaplasia, which are lack of differentiation. So based upon that, well, moderately as well as poorly differentiated, what we use the word as. So in this whole topic we are going to discuss about what is staging, right? Now let's concentrate on staging. Now before going to the major topic of your staging, we need to understand it has been classified into few coding systems, but whatever the sites, anatomical sites and sites involvement, it has been classified into ICD coding system. Now what do you mean by ICD coding system over here? I stand for international, C is classification of the diseases, that is international classification of the diseases which has given some coding system for particular part of your oral cavity, right? So that is, it is giving some codes for the lip cancers, some codes for your oral cavity whole together considered for could be either buccal mucosa involvement, tongue involvement, that should be your ventral surface of the tongue or dorsal surface of the tongue. We have floor of the mouth, alveolus of tongue, and also sometimes there are chances of your gingiva, right? And all those things. So if at all it involves the sites and subsites, again they have their different coding systems also. Now these are all the important questions which they usually asks in the NEET examinations or any type of your competitive examinations, right? So you need to understand the ICD coding systems for everything. Now if you see the book of the oral pathology, whatever the lesions has, all of the lesions have their individual ICD coding systems also. That is, international classification of the diseases has given few coding systems for those things, right? Now let's concentrate on what are the coding systems over here. Now whenever there is a lip cancer, it has again divided into subsites, that is could be external upper lip, external lower lip, which has been classified into vermilion border of the lip, right? And also we have commissural areas, that is your corner of your mouth, like this area, right, wherever there is involvement, right? Now if at all there is external upper lip, the coding system has given codes as C00.0. Whenever external lower lip involvement, it has given it as C00.1. And if at all it involves the commissures, then it has given it as C00.6, right? And whenever comes to the oral cavity is again subdivided into many subsites over here, right? So first and foremost, if at all there is a buccal mucosa cancer, again divided into subsites. In the buccal mucosa also, mucosa involving upper and lower lips, right? That is your C00.3 or 4. This is the coding system which has been given. And for the cheek mucosa, C06.0. For retromolar area, C06.2. Now this can vary sometimes. This can be standardized, and sometimes for the particular areas this can also be varied, right? So bucco-alveolar sulci and upper and lower vestibular of the mouth, the cat has been given it as C06.1. So if you can go in a routine sequence, so that is cheek mucosa C06.0, followed by bucco-alveolar sulci and your upper and lower vestibule of the mouth C06.1, whereas your retromolar areas can be considered as C06.2 over here, right? So in between we have your 3 and 4 also, which is associated with your upper and lower lips mucosa. Fine. Then other than that, we have the cancer of the alveolus. You can see the picture over here, the involvement of the alveolus and the gingiva, considerably considered it as upper gums, that is C03.0. For the lower alveolus and gingiva, we consider it as lower gums. The coding system for this is C03.1. And for the hard palate, now this particular thing has been changed because the area is also considerably changing over here, that is C05.0. And whenever it involves the tongue, right, so that is could be either dorsal surface and ventral surface of the tongue, which is anterior to the circumvallate papillae, or your sulcus terminalis, that is anterior 2/3 of tongue, or posterior 1/3 of the tongue. So these all areas have been given according as C02.0 or 1. And if at all it involves inferior surface of the tongue, that is not the ventral surface, and on the posterior 1/3 of the tongue, that is C02.2 over here, right? So hard palate will be C05.0 over here. So right. So this is again a coding system. Now other than that, there is also a floor of the mouth involvement, and whenever there is a floor of the mouth involvement, now here it is given it as C04. There is no point over there, right? So C04 is standard coding system of international classification of the diseases for your floor of the mouth. So there are sometimes in the exams they can give you question like C04 coding system based upon international classification of diseases. That is, the answer will be for the floor of the mouth. Then if at all it involves the regional lymph nodes, right, especially in the oral cavity, the most commonly affected lymph nodes are your cervical lymph nodes, right? So this is how the anatomical, based upon the anatomical sites and subsites, they usually given the coding systems for these things. Now let's concentrate on TNM staging and what is it is all about, right? Now here T stand for tumor, to be more specific, primary tumor, right? N stand for nodal involvement, to be again more specific, lymph node involvement. M stand for metastasis, to be more specific, this is distant metastasis. Fine. Now let's concentrate on these things. The first one, that is T of your TNM staging. Now here the T can be classified into many types. Now here the major factor involvement in the T is the size of the tumor. And whenever I use the word as tumor, tumor has the size. It could be of small size, it could be of large size. and if at all it is more larger size, it starts invading the adjacent structures. Based upon that, we had given the T as Tx, T0, Tis, T1, T2, T3 and T4. Now here Tx stand for primary tumor which cannot be assessed. Now cannot be assessed does mean that neither clinically nor radiographically, right? And T0, there is no evidence of tumor as of now. Does mean that evidence has been not yet finalized, but yes, there are chances that it is still in the phase of developing into cancer, right? Or it could be in the phase of your pre-malignant lesions and conditions only, right? Now still after that comes is your TIS, where what we use the word as carcinoma in situ does mean that now it has almost going towards a cancer stage, but it is just a one step before the cancer, what we use the word as carcinoma in situ, that is TIS, right? Now then, if you don't treat your carcinoma in situ or don't identify the carcinoma in situ on time, then it goes for the cancer that is being given as a staging as T1. Now what do you mean by T1? I had already told the size is most important over here. If the size of the tumor is equal to or less than 2 centimeter in greatest dimension, we use the word as T1 for this. Now if you consider the buccal mucosa, right, you have a size of the tumor which is either 2 centimeter or less than 2 centimeter diameter, what we use the word as T1 stage. And if at all the size is between 2 to 4 centimeter, that is more than 2 centimeter, less than 4 centimeter, we consider it as T2. This is in greatest dimension. And whenever it is T3, it has to be more than 4 centimeter only, right? And if at all it goes more than 4 centimeter, now what happens, whatever the area it has involved, it starts involving the or invading into the adjacent areas. And if it starts invading the adjacent area, it may go into the mandible, tongue musculature, maxillary sinus and skin, and finally it invades into the adjacent structure, and which has been given it as T4 over here, right? So this is about your T, that is primary tumor, is all about, right? The next will be N, that is nodal involvement. The nodal involvement depends upon three factors. One is either it involves single lymph nodes or multiple lymph nodes. One factor. Either second factor will be it affects the ipsilateral lymph nodes or contralateral lymph nodes, or could be bilateral lymph nodes also. Now here ipsilateral does mean that on the affected part, the area which is involved, right? Contralateral, that is the opposite part wherever it is involved, right? And the bilateral, both towards ipsilateral and contralateral together, we use the word as bilateral lymph node involvement. And the third factor we need to understand is size of your lymph node. Now considerably, if you consider the lymph node size is 1 centimeter, if it starts enlarging to 3 centimeter or more than that, then we consider it as it is something a dangerous situation, right? Now these are the three factors which are most important for the identification of your nodal involvement. Now let's consider these things one by one. Now here NX stand for regional lymph nodes cannot be assessed. Again, there is no assessment for these things, so doesn't mean that it's not still developed, neither it is present, right? And if at all N0, no regional lymph node metastasis, still there is no metastasis has been occurred because it has been not involved also, right? Whereas when it comes to N1, now here it starts, right? Now metastasis has already started. That is, what do you mean by metastasis over here? Metastasis does mean that spread of tumor from your lymph nodes to the adjacent structures, right? Now when your metastatic start occurs, if at all the tumor size is more than 2-4, it starts involving the adjacent structures. When it starts involving the adjacent structures, it starts involving the lymph nodes, and the lymph nodes when starts involving, then it starts moving towards the adjacent parts, and that's what we use the word as spread of your tumor, right? So metastasis 1. Now we need to understand either single lymph node or multiple lymph node involved here, so that is single, right? N1 will be single metastasis lymph node metastasis, plus you can understand here ipsilateral lymph node, that is on the affected part only there is usually involvement. with the size will be either less than or equal to 3 centimeter of the greatest dimension of your tumor, of your lymph node, is considerably in the N1. And this N2 has been classified into three forms, that is N2A, N2B and N2C. Now what are the changes you can appreciate here? So it's like almost the N1 only, single ipsilateral lymph nodes involvement, but the size is varying over here. That is, it has to be between 3 to 6 centimeter in the greatest dimensions, right? Whereas the N2B here, rather than single, now you can appreciate there are multiple lymph nodes started involving, but still it is ipsilateral, that is towards the affected side only present. But now here the size is almost always more than 6 centimeter in greatest dimension. Whereas N2C here you can appreciate, now rather than the ipsilateral, we already have a multiple, plus now it started moving bilateral or contralateral lymph node also, right? With the size is more than always 6 centimeter in greatest dimension, does mean that there is indication that now it is going towards the dangerous stage, more than the dangerous stage, right? And whenever we use the term as N3, now here metastasis already has occurred to the lymph node, has started invading into the adjacent structure. There are chances of even skip metastasis also there in the N3. So this is about your N, that is nodal involvement. And the last will be your distant metastasis. Now here also we have your MX, right? So again we know already MX, that is presence of distant metastasis cannot be assessed, is MX, right? And M0, no distant metastasis. Now if at all M1, that is now here already size of the tumor, that is T, is more than 4 centimeter, right? And also your lymph node involvement also with the size more than 6 centimeter, with bilateral and your contralateral and your ipsilateral involvement, then there is distant metastasis, right? So this is all about these three factors, that is T, primary tumor, N, nodal involvement, M, distant metastasis. Based upon all these three structures of the factors what we have discussed, we classify staging into 4 stages, that is stage 1, stage 2, stage 3 and stage 4. We already know about what is T1, T2, T3. Now one by one we can see stage 1. Now here the size of the tumor is either 2 centimeter or less. Now you can see in the oral cavity the size is less, right? And still nodal involvement is more over here. Usually it has to be N0, remember. So there is no nodal involvement still, and there is no metastasis also. Now based upon if at all size is less than or equal to 2 centimeter, we classify into stage 1. If at all the size is now started increasing, that is between 2 to 4 centimeter, that is less than 4, more than 2 centimeter, we classified into stage 2. Here also there is no involvement of the nodes as well as metastasis, as size is still less, right? Whenever it comes to the stage 3, now here the size has started increasing, that is more than 4 centimeter, right? But still it is or equal to 4 centimeter, still it has not yet started invading into the adjacent structure, that is nodes are not present, neither your metastasis has occurred, right? And T3, T1 or T2, anyways it will be there in your stage 3. But when it comes to the stage 4, now here you can appreciate T can be any T, right? Remember that is it could be T1, T2, T3 and T4, plus nodal involvement is also any nodes, that is majorly it has to be N1, right? So we know already what is N1 over here. N1 does mean that single ipsilateral lymph nodes with 3 centimeter or equal to 3 centimeter in lymph node diameter, right? Size, fine. And sometimes it may increase to the size. The N2C can till it goes to the N2C, that is bilateral involvement also, contralateral involvement also with the multiple lymph node involvement. If this occurs, then finally this M0 whatever has there, it has to convert from M0 to M1, that is distant metastasis has begun, right? So this is all about your TNM staging. This is how the TNM staging has been usually classified for your oral cavity with the coding systems, right? So these questions has been asked in the exams many times. They usually give you case discussion questions like the patient comes to you with the diameter of 4 centimeter involving or invading to the adjacent structures like the mandible, right? So if you see the 4 centimeter and invading the adjacent structure, it is usually classified into T4 now already, right? And the lymph node metastasis, the lead also involve the lymph nodes with multiple ipsilateral lymph nodes. Does mean that we always know N2C, and also there is no metastasis can be noted if we say it is M0. So if they give you this, that is T4 N2C M0, then we need to understand the stage. Or if they give you case, then we need to understand the staging system over there along with your stage, either which is could be 1, 2, 3 or 4, right? So this is all about your staging system. I hope you all understand and enjoyed the topic, right? You need to understand these things, you need to remember, because this is one of the most important for the classification and for the identification of your lymph nodes. Okay, thank you so much for your patient listening.